What if there was a disease that could weaken the very framework of your body, your skeleton, without you feeling a single thing until it's way too late? Well, that is the silent reality of osteoporosis. Today, we're going to uncover how it works, who's at risk, and most importantly, what you can actually do about it. So here's the plan. First, we'll dig into why it's called a silent threat. Then we'll look at your body's framework, the lifelong process of building and losing bone. After that, we'll cover your personal risk factors, how doctors actually find this condition, and finally, we'll get into the crucial steps you can take to manage your bone health. All right, let's jump right in with part one, the silent threat. This really gets to the heart of why osteoporosis is such a massive challenge. It's this invisible risk, hiding in plain sight within our own bodies. So, at its core, what is osteoporosis? Well, the clinical definition says it's a reduction in bony tissue that messes with the skeleton's structural integrity. In plain English, it's a disease where your bones become less dense, more porous, and way more fragile. This compromises their internal architecture, which dramatically increases the risk of a fracture from something as simple as a minor fall or even a bump. Now, this is the really wild part, and honestly, it's a bit scary. There are no symptoms, no pain, no warning signs, nothing. Osteoporosis just works completely in the background. That's why, for most people, the very first sign that anything is wrong is the moment a bone suddenly breaks. And the scale of this problem is just staggering. For a 50-year-old woman, the chance of having an osteoporotic fracture in her remaining lifetime is about 1 in 2. Think about that. For men, it's closer to 1 in 5. And a fracture isn't just a simple broken bone. It can lead to chronic pain, a loss of independence, a totally altered life. This isn't some rare thing. It's a major public health issue. So, how does this even happen? Well, to really understand osteoporosis, we need to look at how our bones work throughout our lives. The best way to think about it is like you're managing a bone bank account. See, our bone health is all about this delicate balance. When we're young, we're in a building phase. We're making deposits into our bone bank, and we reach what's called peak bone mass. That's the strongest our bones will ever be. But as we age, that balance tips. We start making more withdrawals than deposits, and that bone bank account slowly starts to shrink. So how big can you build that bone bank account to begin with? Well, about 70% of it is just decided by your genetics. But that other 30%, that's where your lifestyle choices matter a lot. Things like weight-bearing exercise, getting enough calcium, and hormone levels, especially estrogen, all play a huge role in building a really strong foundation for later in life. This brings us to a super important section, understanding your risk. Because knowing the causes and the risk factors is really the first step you can take toward prevention and management. Okay, so the primary risk factors are often tied to things we just can't control. Aging is the big one, obviously. For women, going through menopause early, before age 45, is a major accelerator of bone loss because of that sudden drop in estrogen. And it's not just women. For men, a big drop in testosterone, a condition called hypogonadism, is a key risk factor too. But it's not just about age and hormones. A whole host of other medical conditions can cause what's called secondary osteoporosis. We're talking about endocrine disorders that throw your hormones out of whack, gastrointestinal issues like celiac disease that stop you from absorbing nutrients, and even chronic inflammatory conditions like rheumatoid arthritis. And finally, our choices in medications play a huge part. Certain drugs, especially steroids like glucocorticoids, are notorious for causing bone loss. And then there are the lifestyle factors that we have direct control over. Smoking, drinking too much alcohol, and a diet that's low in calcium, they all directly contribute to a much higher risk. So if it's a silent disease, how on earth do we find it? Let's dive into part 4, diagnosis and detection. The path to diagnosis is actually pretty straightforward. It almost always begins with that first, often dramatic sign, a low trauma fracture. That means breaking a bone from a fall from just standing height or less. That event is the trigger. It leads to a bone density scan, called a DEXA scan, and from there, doctors will run lab tests to figure out if there's some other underlying cause. Now, this table shows you exactly how that DXA scan result is read. It all comes down to what's called a T-score. A score above -1, you're in the normal range. A score between -1 and -2.5 is called osteopenia, and a T-score of -2.5 or lower, that's the clinical definition of osteoporosis. So you can think of osteopenia as a serious warning sign. Your bone density is low, but you're not quite in the osteoporosis range yet. It's an absolutely critical window to make some changes. But remember, the diagnosis doesn't stop with just the scan. Doctors are going to run a whole panel of lab tests to dig deeper. They'll check everything from your vitamin D levels and thyroid function to screening for conditions like celiac disease. See, it's not enough to know that you have bone loss. The really crucial part is finding out why it's happening. And that brings us to our final and I think most important section, managing your bone health. This is all about the real, actionable strategies you can use to protect your body's framework. The foundation of any management plan is always lifestyle. These non-medical steps are vital for everybody. We're talking about stopping smoking, cutting back on alcohol, and getting into regular weight-bearing exercise. Making sure you get enough calcium and vitamin D is completely non-negotiable, and so is making your home safer to prevent falls in the first place. Now, for those who've been diagnosed with osteoporosis, lifestyle changes are usually paired up with medical treatments. The first-line, most common class of drugs are known as bisphosphonates. So how do these things work? Well, in simple terms, they slow down the cells that break down your bone. Those are called osteoclasts. This helps tip that balance back in favor of preserving bone. They can be taken on different schedules, weekly, monthly, even yearly through an IV. But they have very specific instructions, like taking them on an empty stomach. And while they're generally safe, they do carry some very rare but serious side effects. Of course, bisphosphonates aren't the only option. There are other powerful drugs available. Denosumab is a great alternative that works in a similar way. Teriparatide is unique because it actually stimulates new bone formation. And while hormone replacement therapy, or HRT, was once pretty common, it's no longer a first-line therapy just for osteoporosis because of other health risks that have come to light. And this is absolutely critical to remember. Treatment is highly personalized. It is not one size fits all. What works for a postmenopausal woman, for instance, is not necessarily safe or appropriate for a premenopausal woman, where some of these drugs are actively avoided. Any treatment plan has to be a careful conversation between you and your doctor, tailored specifically to you. So, what's the big takeaway here? What's the bottom line? Yes, osteoporosis is a silent threat. And yes, it can have devastating consequences. But it's not a mystery. It is detectable, it is manageable, and most importantly, with the right combination of lifestyle choices and medical care, those debilitating fractures are preventable. And that leaves us with one final question for you to think about. Knowing that your bone health is a lifelong project, what steps will you take starting today to protect your body's framework for years to come?